Okay, picture this. It's Monday. A 3-year-old lab walks in and the owner says he's just tired, off his food, threw up a couple times. Nothing dramatic. 2 days later, that dog is in acute renal failure. What happened? He went swimming in a puddle. That's leptospirosis, and it is the disease that will humble you in your first year of practice. Lepto is a spirochete that lives in the urine of wildlife: raccoons, rats, opossums, deer, livestock. They pee in standing water or damp soil, and the organism can survive there for weeks. Your patient wades through it, and the bacteria slip in through mucous membranes or any little scrape on the skin. No bite, no direct contact, no obvious exposure, just a puddle. Clinically, the big one is acute kidney injury. That's your most common presentation. But lepto is a shape shifter. You may see liver failure with jaundice or just fever, vomiting, and lethargy. Chronic and carrier cases can show up with uveitis. And the scary one, peracute pulmonary hemorrhage syndrome, where they bleed into their lungs. The takeaway: lepto mimics almost everything, so your index of suspicion has to be high. For diagnosis, mass serology is your gold standard, but remember, it's paired titers, so it takes time. PCR on urine or blood is your friend early in the acute phase before antibodies climb. On blood work, look for thrombocytopenia and leukocytosis, elevated BUN and creatinine, elevated ALT and bilirubin, and do not skip the urinalysis. Proteinuria, glucosuria with normal blood glucose, and granular CAS are all screaming renal tubular damage. Prevention is where you get to be the hero. The 4-serovar vaccine with annual boosters works, and it belongs on far more dogs than people think. Counsel owners to keep dogs out of stagnant water and away from wildlife hangouts. For treatment, penicillins or ampicillin in the acute phase, then doxycycline to clear the carrier state and stop urinary shedding. And here's the part I want burned into your brain. This is a zoonosis. That urine is infectious. Hospitalized lepto suspects get contact precautions: gloves, gown, eye protection, and a very clear sign on the kennel. You can absolutely take this home. Protect yourself and protect your team on every suspect case, not just the confirmed ones. Last thing, if you learned lepto as a rural farm dog disease, update that mental file. Flooding events spread the organism widely. Urban wildlife carries it, and we're seeing rising cases in suburban dogs across the Northeast, Pacific Northwest, and flood-prone regions. So the next time a city dog comes in vague, lethargic, and vomiting, put lepto on your list. Your patient's kidneys are counting on it. If this helped, like, subscribe, and share for more.